of the right lobe, just hanging out there, that never would have seen if you didn't scan all the way through. So from here on out, whether it's liver, pancreas, kidneys, bladder, uterus, whatever it is we do from this point forward, you are scanning all the way through both sides of the margins, superior and inferior, lateral, medial, of all these organs. So get in the habit now of when you're scanning, don't just go to where your picture is, all the way through, look at it, because we are not picture takers, right? We're diagnostic medical sonographers. It is our job to tell the radiologist that this segment of that organ is normal or not normal. So you have to be diligent about looking all the way through, okay? It's not just about taking pretty pictures. I don't know if this is gonna be warm or not. I fell out of my chair. I like hooked my foot so I didn't fall out of this chair trying to grab the gel. Oh my goodness. All right, so let's start with left lobe. Okay.
And pay attention to her annotations. Remember what we talked about before we were doing aorta. So y'all need to make sure y'all are doing it in the order that we had talked about before.
Okay. All right, so we're gonna start with the lateral. Deep breath and hold it. So I put my probe down right in the middle, same as if you were getting aorta, but now we're looking here. So I'm gonna scan all the way to her left and all the way out of that organ, do you see? And then we're gonna come back to my landmark, breathe, which is this. This is that pizza slice. Some look more like a pizza slice than others, but it's essentially this triangle look here. So to know that I'm in the lateral portion of the long left lobe of the liver is I went all the way to her left and back in. This is gonna be my margin between abdominal cavity and thoracic cavity. So this is her heart, which sits superiorly to the lobe. So I wanna see this margin and this margin, okay? Deep breath and hold it. So if I'm out getting this lateral picture and it's like this, not acceptable. This, not acceptable. Contact loss and I'm cutting it off. So make sure we're centering it right in the middle of our screen. Breathe. Okay? Any questions on this so far?
And it's lateral on the organ, not the body. I think Lisa said she thinks she told y'all wrong in lecture the other day. So make sure it's lateral to the organ, not the body.
Mm-hmm. All of the imaging is going to be on the organ. So because everybody's organs are going to have variations in how they lay in the body and how they present, you're going to be focusing on getting the length of the lobe on that person's liver, right? It's going to be a little bit different on somebody else's maybe. Maybe you're not like this, but you're like this. You have to accommodate to the organ, okay? All right, so this, again, this is going to be your landmarks here, is seeing this diaphragm, heart, and the fact that there's really nothing else around it, honestly. Now, some of you real skinny ones, very narrow-bodied people, you may actually have somebody's left lobe of the liver that extends all the way over to like their spleen. So you may see spleen in your picture, depending on the size of the body you're scanning, or the age if you're scanning a young person. So don't get freaked out when you see something else in your picture. All right, deep breath and hold it. Breathe. Okay, so this is going to be your mid. Your landmark for mid is the aorta, which you guys are all very familiar with, right? Again, I'm seeing this margin and this margin. We're not cutting anything off. I don't have too crazy of a depth. If you bring this up to here, I can't tell that that's mid on her liver because I don't see her aorta. Okay, so don't overdo it with your depth, but I don't want a ton of it. So this is about what we want to see here. Okay? Any questions on the mid? Okay. Deep breath and hold So from mid, I'm gonna come medial on her. Breathe. Okay, so you see how I went all the way to the IVC and back? So I went all the way to her IVC and then back towards the midline a little bit because this is the caudate lobe right here. This is her caudate lobe. What separates the left lobe from the caudate lobe?
Ligamentum venosum?
Hmm?
Ligamentum venosum?
Ligamentum venosum. So again, same things apply. I want to see all the edges here, but this is going to be your medial landmark. Deep breath and hold it. If you go to the IVC here, now we're getting into the right lobe, so you've gone too far. Okay, so let this be like your this road ends here sign when it comes to left lobe. So if you see that, go slightly back and you're gonna get that picture, okay? That's gonna be medial. Any questions on the landmark so far? Nope, okay. There, okay. All right, so now for superior in trans. Another thing too, when we're doing the lobe, we're not doing a lot of this movement. It's more of staying planted and doing these movements, your angles, angling like this, okay? You're gonna have to be working around ribs now, so you're really gonna have to start to work on your angles, okay?
You're pretty much like right below that xiphoid, like right where it kind of dips
Prox
down.
side, yeah, right where you guys have been for prox aorta. Now, keep in mind when you're doing someone like Michael, men have more of their abdominal organs up in their rib cages. They extend further down into their abdominal cavity. Women, not so much. We tend to have a little bit shorter rib cages, but the men, that left lobe can be really hard to see sometimes. So you may have to be all the way up and like on top of their sternum to be able to see that left lobe. Also, you may have to roll them decubitus on their left side to see the left lobe, because you're gonna need to roll over in a position where you can angle more into that side, okay? If you roll them towards you, how awkward is that to try and scan like that, okay? So keep those things in mind. You may still need to change your patient's position to see these things better. So for superior, the landmarks for superior are gonna be kind of like the lateral. You're gonna go all the way superior and back down. You'll see a little bit of the heart, and there's no blood vessels in that picture. So you won't see the hepatics and you won't see the portals. Deep breath and hold it. So again, my angles, look at the angle that I'm taking here. I'm not like straight up down like this. I have more of this scooping kind of action, so I can go all the way up and through and back down. Breathe. So superior because I got the heart in the picture, so I know I'm superior, and I can see this whole edge here. Okay? No blood vessels. It's just the liver tissue. Alright, deep breath and hold it. So the mid, you're gonna come up through, take your superior, keep angling down. These are hepatics. Those are portals. So when we talk about recumbent H, I'm just gonna show you. I can get your recumbent H. Okay, breathe. All right, so I'm cutting off a part of the liver here, but I want to show you guys that recumbent H. It's made up of the portal veins. And does anybody know the difference between the portal veins and the hepatic veins when it comes to the sonographic appearance of them?
The portal, yeah.
What's more hypoechoic?
The portal veins, because they have fattier walls.
The walls, exactly. So they're gonna have more echogenic hyperechoic walls compared to the hepatics. They travel different directions as well. So the recumbent H is like an H on its side of the left portal, or the left portal branch, and all of its additional branches that go out into the liver. So that's what you're getting with the recumbent H. Deep breath and hold it. See how I just kind of passed it right there. Breathe. Yeah, so it's this part right here, okay? Now, I want you to get the recumbent H because that is your landmark. However, I also want you to show me that portion of the liver. So like before, I was kind of cutting this off. I couldn't see it. So what you want to do is just angle around a little bit more to bring this part into view, okay? Because I don't want to cut off that corner. Deep breath. So that's going to be my mid picture, okay? Any questions on that?
That's beautiful.
Oh, you're such a pretty liver scheme. So this is the recumbent H. And another thing I want you guys to try and remember is I want focus on the left lobe. So when I say I don't want you cutting something off, when we get into the transverse, you're ignoring all of this over here because that's right lobe. You're gonna get some of that in your picture. So don't get distracted trying to get something over here when what we're focusing on is the left. We're gonna take pictures of the right lobe later. So that's not the focus of this image. So I wanna see all of these borders here, okay? And inferior. Deep breath. Breathe. Okay. And again, you saw me go all the way through inferior and then back up. So the landmark for inferior is going to be the pancreas right here. You may see all of it, you may see the head, you may see the tail, but some portion of the pancreas should be in the inferior left lobe picture to know that you've gone inferiorly enough, okay? Now, if I see all pancreas and no liver, too inferior, okay? This is going to be it. This right here, pretty sure it's this one. Anybody know what that is?
Ligamentum teres.
Yes, ligamentum teres, very echogenic structure that's going to shadow in that left lobe. You're probably going to see that in your inferior pictures too. So this is going to be her inferior left lobe right here. And also I decreased my depth. Probably could do a little bit more because I'm looking here. I don't need all of this. This is my landmark. This is a pancreatic head, portosplenic confluence coming from the splenic vein, pancreatic body and tail. So that is what that looks like on her, okay? It might be a little bit more echogenic than the liver, might be a little bit more coarse, maybe really hyperechoic depending on what's going on with that patient. So those echo textures are probably gonna be different. So you guys can see the difference in that, right?
And if you're having a hard time picking out that pancreas tissue, look for that portosplenic confluence. That's gonna be
That's a good
your
landmark.
landmark
Yeah.
for that.
All right, any questions on left lobe so far?
And sometimes if taking in a breath for that is too hard, you can push out your tummy and that'll make that pancreas stand out a little.
Yeah, so this is her just breathing regular. You guys saw what it looked like with the deep breath. I'm pushing belly out. Look at that. Breathe. Do you see now with the difference? And I can see more of her pancreas here. This is the head of the pancreas. This is still that portosplenic confluence, okay? And here we're looking at inferior lobe. So if you see the aorta and you see this liver, you should have a pancreas somewhere here in between in that inferior section. Okay? Your pancreas so pretty. All right, right lobe.